My name is Brian Johnson, Certified Health IT Security Administrator and Senior Director of Online Education for Format Approved. I'll be the narrator and instructor for this professional video learning series. The role and importance of information technology in healthcare has evolved rapidly in recent years. Much of this change can be traced to the April 2004 decision of President George W. Bush to establish the Office of the National Coordinator for Health Information Technology as part of the U.S. Department of Health and Human Services. The Office of the National Coordinator is usually called the ONC, and the U.S. Department of Health and Human Services is usually called HHS. The ONC was tasked with establishing a framework for technological transformation in the healthcare system, especially for the adoption of electronic health records, or EHRs. EHRs are also called electronic medical records, or EMRs. President Bush set the goal that within 10 years, every American should have an EHR. However, the role of the federal government in adopting EHRs was largely limited to setting technical standards at this time. In 2008, candidate Barack Obama made healthcare reform an important part of his presidential campaign. Obama called for insurance reform and universal coverage. He also proposed $50 billion in funding for incentives and other measures to encourage rapid adoption of EHRs and other health IT. On February 17, 2009, President Obama signed the Health Information Technology for Economic and Clinical Health Act, known as the HITECH Act, as part of the American Recovery and Reinvestment Act, or the ARRA, which is commonly called the stimulus. The HITECH Act provided more than $20 billion for the healthcare system to adopt and meaningfully use information technology to improve health. Under the law, meaningful use consists of goals and thresholds providers must meet to demonstrate that they are making effective use of health IT. The HITECH Act was an ambitious effort to accelerate the adoption of health IT. It included $2 billion for the ONC, $17 billion in EHR incentives through Medicare and Medicaid, legislative codification of the ONC, grants and loans to foster the use of health IT, and new privacy and security provisions. The HITECH Act directed the ONC to undertake activities, quote, consistent with the development of a nationwide health information technology infrastructure that allows for the electronic use and exchange of information, end quote. The ONC created the National Health Information Network, also known as NHIN or NWHIN, to promote health information exchange. Health information exchange is called HIE. HIE can refer to the action of electronically exchanging health information, but it also refers to organizations that facilitate such exchange. NHIN, now known as the eHealth Exchange, promotes common standards to enable HIEs to communicate. The ONC also funded dozens of regional extension centers, which are usually called RECs. RECs help providers adopt EHRs. RECs have been an especially important resource for smaller and rural practices, as well as critical access hospitals and community health centers. The funding for ONC also provided federal and state grants to promote the adoption of EHRs. For an eligible professional, or EP, to receive a share of the $17 billion in incentive funds, the following requirements must be met. The EP must adopt and meaningfully use a certified EHR product that includes e-prescribing functionality. The EHR must connect to other technologies using HIE standards. The provider must comply with submission of reports on clinical quality measures, which are called CQMs. Certified EHR technologies fall under two categories. 1. Ambulatory, for office-based physicians, and 2. Inpatient hospital, for hospitals. The EHR must be certified by agencies that have been approved by ONC, meeting specific standards that include, but are not limited to, collecting patient demographic information, providing clinical decision support systems, or CDSS, supporting computerized physician order entry, which is called CPOE, exchanging and integrating electronic health information with other sources. The Health Insurance Portability and Accountability Act, called HIPAA, has also played an important role in the adoption of health IT. HIPAA was passed by Congress in 1996, largely to reform insurance coverage and lower healthcare administration costs. HIPAA also protected the privacy of patient health information, creating a legal category of information known as Protected Health Information, or PHI. PHI includes identifiable health information in any form, whether print, electronic, or verbal. HIPAA required the protection of PHI by essentially all healthcare organizations, which are known as covered entities under the law. The HITECH Act enacted new privacy and security provisions under HIPAA, especially with regard to electronic PHI, which is called ePHI. HITECH also significantly increased enforcement activities with increased compliance auditing, larger civil penalties for violations, and new requirements that healthcare organizations publicly disclose breaches of PHI. It required the businesses that provide services to covered entities to comply with HIPAA, subjecting them to civil and criminal penalties. Such businesses are called business associates. Business associates provide a wide variety of services that may involve access to PHI, including IT support and document processing. HITECH also gave state attorneys general the authority to enforce HIPAA civil penalties. These penalties, which are administered by the HHS Office for Civil Rights, called OCR, can include fines of up to $1.5 million for the loss or release of PHI. Criminal penalties include fines and imprisonment for up to 10 years for the intentional misuse of PHI, whether for gain or harm. Criminal provisions are enforced by the U.S. Department of Justice. The HITECH Act also made HIPAA requirements a part of demonstrating meaningful use. Healthcare providers that wish to qualify for EHR incentives must demonstrate that they are meeting their HIPAA obligations. Building on the HITECH Act and recognizing health IT as a critical enabler to broad transformation in healthcare, the ONC published a roadmap for adopting health IT on November 10, 2011. The Federal Health IT Strategic Plan 2011 to 2015 lays out a national strategy for improving healthcare through the use of information technology. The plan states that health IT has the potential to empower individuals and increase transparency, enhance the ability to study care delivery and payment systems, and ultimately achieve improvements in care, efficiency, and population health. Goals outlined by the Federal Health IT Strategic Plan include: achieve adoption and information exchange through meaningful use of health IT, improve care, improve population health, and reduce healthcare costs through the use of health IT, inspire confidence and trust in health IT, empower individuals to improve their health and the healthcare system through use of health IT, achieve rapid learning and technological advancement. The ONC maintains and updates the plan by working with public and private sector stakeholders and by seeking public comment. The Patient Protection and Affordable Care Act, or the PPACA, which is often referred to as Obamacare, was signed into law on March 23, 2010. The PPACA changed the country's healthcare system by expanding insurance coverage of young adults, outlawing lifetime limits on insurance coverage, lowering the costs of drugs for seniors on Medicare, and expanding access to free preventative care for patients of all ages. The largest transformations caused by the PPACA went into effect on January 1, 2014, requiring health plans to provide coverage for preventive services and immunizations, uniform application of standards to all health plans, states to establish basic health program exchanges, hospitals to establish and make public a list of all standard charges for items and services, and individuals to maintain minimal essential healthcare coverage. To effectively fulfill these requirements, there is now a significant need for technology to capture, store, access, display, and transmit an unprecedented volume of data. As the PPACA aims to improve quality of healthcare and lower costs, providers across the nation are experiencing increased pressure to document and track the costs and quality of their services. In these ways and others, the PPACA moves toward a pay-for-performance model, which would reshape the healthcare system.